Yeah, this 5-year-old boy first came to me in November 2010. He was referred by another colleague of mine for his very bad epilepsy that he's been having.
We never knew what a seizure. We could see that helplessly. We felt very helpless at that time.
This child was their only child, and he was born premature. He was born at about 33 weeks of pregnancy, and the child at that time weighed only about 1.6 kilograms. And what happened, unfortunately, was that the child had a brain hemorrhage related to this premature delivery.
It was at the age of 2 years, 2 months when it started.
Since then, this child has been regularly getting seizures, and the seizure would start off with the head and eyes going to the left side, and then he would start jerking his left-sided limbs, and he would become unconscious.
He was getting a seizure which used to continue for sometime 1 hour or 1.5 hours. Say I'm into an office, or suppose I'm on my way to office. I had to take some cab or something, I rushed back to home, and not to home, sometime to the hospital, and it went for in the hospital and all these things going on. Maybe after it takes 24 hours for him to normalize.
And there was not a month where the child would not have a seizure. And the child was already on 5 anti-epileptic medications. And despite all these 5 anti-epileptic medications, the child would definitely not become seizure-free. And it also had an adverse impact on the cognition of this child, because he found it difficult to speak properly. He did not achieve the kind of cognitive milestones of a child of his age.
He has a lots of balance problem. He was a difficulty to step up and step down. Has a big difficulty with the writing. He was not gripped the pencil at all.
Every time I'm scared that he'll get an attack. Is anything, suppose he's running around too much, he's having too much of, say there's a little bit of sleep is disturbed, he's got a little bit fever, I'm scared.
Medicine was not working. Then we were searching the option, the final option, and we had to give my kid the normal life, because as a parent that was one of my duty, and that's why we met Dr. Naik.
I have been following up this child from November of 2010, and I felt that there is a chance for this boy, because based on certain investigations, we found that he could benefit with surgery.
Surgery is an option, but I said, okay, fine, we will look for it. It was not so easy decision.
It was a scaring object, that brain surgery. We had to take the calculated risk.
We proceeded, we discussed these findings with the parents, and we said that there's a very good possibility or chance that this child could become seizure free. And then on January 20th of 2012, we proceeded with the surgical treatment.
It was a good decision, because nowadays he is more active, and previously he was feeling sleepy, a drowsiness was there, a balance problem was there. But nowadays he is very much active and talkative, and he can understand all that, and he is now ready to go to school.
So although the surgery is prolonged, the recovery is very quick, and they generally, for example, Maitreyo got discharged by the 4th day. He was back home.
Now he has improved a lot, and he can climb stairs without help, and climbing down also, and he can jump also. Previously he won't have jump at all. Now he can jump also, and he can run
Without falling.
without falling, yeah. Previously, while turning time, he stumbles a lot, and sometimes he falls down. But now he has that balance, and he has improved a lot.
The awareness is still, I'm saying a lot of awareness is required, is still very low. People doesn't know that epilepsy can be treated fully maybe 80% or more than that because
With
of
the
by
surgery.
surgery. That is, if something is not curable through medicine, it can be cured by surgery. I, as an example, my kid can tell that.
And the gratifying thing is that the child has stopped having seizures, and the child has not seen a hospital subsequently, because every month this child would be admitted to hospital, and this child, in fact the parents are now slowly forgetting their past experience of visiting hospitals, visiting intensive care units, getting intravenous drips, etc., etc.
Now I am, as a mother, very grateful to this operation and this all team of Dr. Naik.